Thanks everybody for attending this session, this dialogue during Digital Health Week. This is the second dialogue as part of the Roadmap to 2030 process that we're co-creating with our partners and with you through this process. This dialogue is called National Policies, Legislation and Regulation, and it is co-hosted by Unite, Kaylin, Imara Leadership Initiative, and AHIN. I want to start the dialogue by talking through the agenda and setting out some rules of engagement, some house rules for us to abide by. So the agenda is split into different sections. We will start by setting the scene and explaining the context of this particular initiative that we've been working on. We then want to get some of your quick initial thoughts on this and on some of the big themes that we've identified and get your reaction to this. We will then start a process of reflection with the co-hosts and invite the co-hosts to share some of their thoughts. We will then come together as a group and explore this particular set of issues, the ambitions, the milestones we feel or we would like to create with you in order to build out this roadmap and set ourselves some collective ambitions going forward. We will then share another round of reflections, and we will then look at the next steps and close out. Now, for the house rules, we would like to invite you to introduce yourself in the chat function. Tell us who you are and where you're from, just so that everybody knows, has a sense of who's participating in this particular initiative. Please use the chat box if you have any questions or suggestions throughout the dialogue. We may not see them immediately, but we will come back to them and we will try and answer every single question or address any comment as part of this process. If you want to make a comment during any of the breakout sessions, please put your hand up using the icon that you see at the bottom of the bar, and we will get to you and invite you to make your comment. Please make as many comments as you like in the Miro board as well. We want to create this with you. This is not a finished product that we're presenting. It's a work in progress, and it's a piece of work that we really want to develop with you and your active participation, leveraging your thoughts, your experiences of this particular set of issues so that it's relevant to your work, to your realities. That's very important for us. So please treat this space as your space. Now, I would like to introduce you to the co-hosts for today's session. We've got let me just make sure before I say anything provocative, but we have Guillem Gonzalez Duarte from Unite Parliamentarians Network. Welcome, Guillem. We have Jai Ganesh from AHIN. Welcome, Jai. We have Patrida Paul from the Imara Leadership Initiative. And unfortunately, Alan was not able to join us today. So we're very fortunate to have Martha Ogutu stepping in his place, who brings a wealth of expertise. So we're very fortunate to have her step in, and looking forward to your participation, Martha. Now, before we go into the roadmap process and the co-creation, we wanted to tell you a little bit, or to explain to you a little bit about where this initiative comes from. We felt last year, at the end of last year, we thought it would be a good idea to develop an initiative that would help us to work in a collaborative manner and a much more coherent manner leading into the last 5 years of the Sustainable Development Goals, to really try to to create a step change in the whole process of the digital transformation of health systems to accelerate universal health coverage. We've seen a lot of traction in digital health. A lot of it's really come to attention and fruition, but the sector is still suffering from some of the same old challenges. And we feel that that's largely to do with the enabling environment as well as other issues. But the enabling environment could resolve some of these challenges. And we felt that if we collaborated more effectively around certain key priorities, we could really achieve a significant impact and create the right environment for the digitalization to happen at speed. So we wanted to create an initiative that was practical, that had a clear sense of a vision to achieve universal health coverage through digital transformation of health systems by 2030, but also had a set of milestones that we can work on together, and also had a certain set of a framework that could be interpreted to different contexts. Um, so the roadmap is a shared global effort to guide how digital transformation can help us achieve universal health coverage, and also to contribute to other very important initiatives. The upcoming global strategy on digital health that's about to be updated in 2028 to 2030, the UHC action agenda, the UHC 2030 strategic priorities, the Global Digital Compact. All these are very important processes that governments have committed to and are getting behind. We felt that there was a need for us as civil society and a more eclectic group, if you like, that includes private sector, academic organizations, professional bodies, technical experts, some members of governments as well, to come together and see how we could collaborate and leverage our collective expertise and our political weight in order to drive this forward. So the roadmap sets out what needs to change, who needs to act, and how we can act together in order to achieve that change. And we very much want to create it with you and work on it with you so that we can drive this forward. Now, where did the information and the analysis, how did we decide on the particular sets of issues that we want to address in the roadmap? We conducted a situation and trends analysis earlier in the year called Framing the Future, the current state of digital health transformation, the current state of digital transformation of health and the road to universal health coverage. And in that report, a thorough analysis that I highly recommend, and developed in order to provide some practical insights to drive strategy and to guide action. We found a number of themes. So one of them is that impact is not determined by technology. The technology worked. It's been working for the last 20 years, updated, accelerated over the last 10 years. COVID has demonstrated just how effective it can be. The technology is there and it works, but what's missing is the politics. That was one of the main, a critical finding of this analysis. Government leadership and ownership is critical for change to happen at scale and in a sustainable manner. And we can't just assume the government leadership happens. We need to sort of work at ensuring it's there. Coordination and national alignment is necessary to make progress, to manage multi-stakeholder initiatives, to ensure that there is no fragmentation and duplication. That function is a critical one. And again, that does not happen organically. It needs to be intentional. Transformation needs to be rights-based, equitable, and inclusive. Technology is agnostic and adopted and implemented in a system where there are power imbalances will only replicate and maybe even increase those power differentials. Digital technology needs to be developed through an equitable, rights-based and inclusive lens in order to address some of those inequities. And this can only happen by strengthening the enabling environment. Now, those are some of the key messages that come out of this report. And again, I would recommend you go and have a look at it if you have time. Now, The themes we've pulled out of this analysis to inform this roadmap are the following ones. Equity and inclusion with people at the centre. We had the dialogue on that yesterday, which was very productive, very successful, and you know, sort of threw up some very interesting insights that we'll be consolidating and sharing with you all over the coming weeks. This second dialogue, national policies, legislation and regulation. Um, the other themes to come up are the resource and investment theme, that which we will be discussing tomorrow, national leadership management and coordination, Thursday, and infrastructure standards and interoperability. And we would recommend, if you haven't done so already, please sign up to these dialogues and join the conversation and let us know what you think about these specific themes. Now, we're building this dialogue out in we're building this dialogue out in two phases. This is the first phase that we're going through, where each theme is being developed through a process of consultation, through the dialogues, through partner consultations that we've already had internally to get something that's worth your time engaging on during these processes. And these reflections and comments will be consolidated after Digital Health Week so that we can build out a more detailed version of the roadmap and also highlight some of the relationships. All the themes are related, pulling them out into certain buckets is necessary in order for us to be able to sort of, break the pie down and sort of eat it in a more manageable way, if you like. But we're doing this, and then we will put it all back together so that we can go much more in depth into all these themes. The second phase, we will open up a process of public consultation that will close. I was going to update this on the 5th of December. Please forgive the date. And that will give you and your colleagues and others an opportunity to reflect on the bigger picture, if you like. So yes, sorry, I didn't update this. And the roadmap will be launched on the 12th of December. Now, what did our analysis reveal in relation to this particular theme, which is the legislation, policies, legislation, and regulation? Digital transformation is not only technical. It redefines the relationship between people, data, and institutions, and trust is at the foundation of the digital transformation. Also, your data is at the heart of the digital transformation. Digital is mainly the capacity of technology to manage, to collect, manage, interpret, store a large and dispose of large amounts of data, and make things happen, plan, predict, and better manage systems through the generation of this data and information. So we, as citizens, need trust in those systems that are collecting our data to use them in an accountable, transparent, and manner grounded in human rights in order for this whole system to work effectively. The situation and trends analysis revealed a significant gaps in digital health governance. Some countries have very strong health health governance models and frameworks. Some are rather lacking. Some have good frameworks, but they're not being implemented. So it was quite a mixed bag. Many countries lack comprehensive legal frameworks for data protection, privacy, and ethical use of digital technologies. Where policies exist, they are often fragmented across ministries or lack enforcement mechanisms. Sometimes it's almost like an archaeological dig. You see, older regulation and legislation that's been that superseded but not eliminated, so not sunsetted, with other pieces of legislation and regulation. Some of it isn't really compatible. Some of it sort of doesn't work well together, and even sort of creates ambiguity that makes governance very, very difficult and ambiguous. So weak government, the governance undermines both public confidence and regional cooperation, especially as health data increasingly crosses borders. The importance of strong legislation and regulation and strong policies on digital health would address this. Now, taking that as the challenge, the set of challenges that was identified, we created, or we came up with this particular goal. By 2030, so this is where we want to get to. By 2030, countries establish digital health governance frameworks that are inclusive, equity-driven, and rights-based. Countries that already have developed digital health governance frameworks are implementing these and have established clear accountability mechanisms. That's where we want to end up by December 2030. Now, we've identified different levels of engagement. At the global and regional level, we want to promote convergence and shared learning across governance frameworks, supporting mutual accountability on data protection and ethical use of artificial intelligence. At the national level, we want to establish or strengthen legislative and regulatory frameworks that ensure accountability, transparency, and respect for rights. In the case where these are established, we want them to see them implemented. And also the conditions for implementation will require funding, will require coordination and all of that. And that's where this particular theme intersects with other themes. At the community level, we want to enable citizens and civil society participation in the development, monitoring, and evaluation of digital governance policies. In the case where these have been developed, we want to enable civil society to fulfill its accountability role. Now, what do we want to see happen? That's the overarching framework. Every country has a rights-based framework. We want to see every country having a rights-based framework for digital health governance, laws, policies, and institutions that protect privacy, security, and the ethical use of data. We also want to see accountability and oversight mechanisms that are independent and effective. Public trust is strengthened through transparency and regular review. We also want to see cross-border policy coherence and countries and regions collaborating on shared governance principles, harmonized standards, and mutual accountability. Finally, we want civil society and affected communities to participate in governance, decision-making processes, and to include those who are most affected by digital transformation. That's what we want to see happen. So those are the milestones we want to achieve on our journey from now to 2030 in order to achieve this. Now, finally, how, what we will prioritize in our work to make this happen. So what we want to make happen in a much more concrete level. We want to conduct comprehensive legal and policy gap analysis to inform reform. We want to enact and update legislation on data protection, privacy, and cybersecurity aligned with international norms. We want to establish independent oversight, or we want to see established independent oversight and advisory bodies for digital ethics and accountability. We want to see public consultations facilitated and participatory policy processes taking place. We want to see the promotion of peer learning and regional exchange on governance practices. We want to see human rights embedded and equity principles embedded in all digital health policies and frameworks. And finally, we want to see the development of mechanisms for public reporting on data governance, performance and breaches. So those are the steps again, the mini steps in the way, the sub if you like, milestones. What needs to happen in order to achieve these 4 milestones? And I'm sorry I'm talking a lot, but we'll have a chance to unpack this. I just wanted to present to you a picture of what this roadmap on this particular issue is looking like. So it looks like a big goal, a set of milestones, and a set of staged changes in order to achieve those milestones. And this is what we would like to get your thoughts and opinions on. Now, I'm going to hand it over to my colleague, Christiana, to take us through the next stage. Over to you, Christiana.
Hi, everyone. I hope you are listening intently because now we're going to get your perspectives on what you just heard. So here's the QR code for the Mentimeter. I will also put the link in the chat box. It's just shared now. There's about 5 questions to go over and reflect on what you heard and from your particular perspective so that we can really get you engaged and excited about this. So I'm going to move over to the Mentimeter now and share my screen. 1 second. All right. Sorry. Got ahead of myself. All right. Okay. All right. This isn't the first slide, I don't think. Oopsies. Come on. No, I want to go to the first slide. Jumping ahead here. Okay. So, what is one word that best captures your reaction to what you just heard? Okay. All right. Comprehensive.
Christiana, would you like to share your screen so we can see the
Oh,
Mentimeter?
I'm not. Oh, isn't my screen being shared?
No, please be my guest.
Oh, I was sharing
It is.
it. Okay. Sorry?
Yes, we can see your
It
screen.
is
That's great,
visible.
Christiana.
Oh,
It's visible.
Okay. I thought so. Amazing. Comprehensive. Okay. Hopeful progress. I like that. Still like amazing though. I mean, it is quite amazing. Exciting, ambitious, ambition. Okay. I like that comprehensive keeps being the biggest. That's so important. Intriguing. Great. I'm gonna wait till 35 people have responded, and then we'll move to the next slide because we have 42 on here. All right. 2 more people. All right, I'm gonna go to the next question. Thanks, everyone. Ambitious. That's astounding. That's great. Okay, so from 1 to 5, 1 being not at all supportive and 5 being very supportive. I'm not sure why they Mentimeter won't let me do any middle middle selections. But do you feel that existing national policies and legislation in your context support equitable digital transformation in health? So 1 being no, it doesn't support that, and 5 being yes, very supportive in your opinion. Okay. Thanks for the thumbs up, everyone. Cool. 1 second. 1 second. I see your hand. Is there an issue? Go ahead. I see your hand. Okay. All right. I'll wait for 36 people and then I'll move to the next one. I mean, 2.9 is not a great score, if we're gonna be honest. Okay. All right, I'm gonna go to the next one. based on the presentation, which gap do you think most undermines progress in digital transformation? So pick the one that you think most undermines progress of the 5 that are listed. Thanks for the thumbs up. All right, I'll let 5 more people answer this question, then we'll move on. All right, I think we've hit a zenith here. All right. Oh, one more. So right now it's inadequate or fragmented legislation and regulation. That is what everyone feels. But I mean, the other 2 above and below are quite strong as well. Okay, thank you for your reflections. So what's one ingredient or component that would help strengthen trust in digital health governance? And this is just a word, this is just an open text. So just your thoughts. A sentence or a word. What's one ingredient, one component that you think would strengthen trust in digital health governance? Or policies for digital transformation generally. All right. Government involvement. Okay. Collaboration, no corruption. Yeah, that's collaboration. Robust data governance, data transparency, plus or minus. All right. Leadership. Be interesting to know leadership from whom, from countries, or what group of institutions, or what group or organizations would be the one that you see leadership we need it from. Leadership and accountability, okay. From the government or from other stakeholders. One key ingredient that would help strengthen trust in digital is human oversight. Digital health systems, particularly those using artificial intelligence, must be developed. Oh, sorry, your text got cut off there. Maybe you can put it in the chat so we can see it in full. Put your money where your mouth is. A lot of talk. All right, walking the talk. Okay, health education and promotion. All right. Shall I wait? One more. Ownership and implementation of current laws on digital health by government. Okay. Some good stuff here. Comprehensive, tech-led, locally developed and focused, properly legislated, data-based, centralized and devolved oversight backed by government regulation and education. Yes. Amazing. These are all really great. Thank you so much. All right. One last one, I believe. Okay, so on a scale of 1 to 5 again, 1 being not achievable at all and 5 being very achievable, the ambitions and collective actions, sorry, that's supposed to say collective actions, not collective actions. Collective actions presented are achievable within 5 years, 2025 to 2030. So again, thinking through the presentation from before and the kind of ambition and actions that we propose as illustrative, how achievable do you see those being realized by 2030? And you can be honest. We don't know. You don't know. We can't see you, so we won't ask you why you said what you said. Don't worry. It'd be really interesting if anyone is feeling brave after this Mentimeter is done, if anyone wants to put up their hand and reflect on what specifically feels achievable and what within that doesn't feel achievable, or what could make it achievable. That would be a really interesting thing to unpack. And maybe we'll get to that during the dialogue later in the session. All right, I'll wait 3 more people and then I'll end the Mentimeter. It's been great. 3 more. All right. 2 more. 1 more. Cool. Well, I'll cut it off now, but thank you so much, everyone. This has been really helpful and really interesting to see your feedback. I'm going to stop sharing my screen now. All right. Thanks, Frank. Over back to you.
Fantastic. Thanks so much, everyone. This was some really good discussions here. I'm now going to pass it over to our co-hosts. I'm going to start with Jai, who's joining us from the Philippines, I believe, and it's quite late there. So, Jai, I'm going to invite you to share some reflections, on what you've just heard. And I'm going to invite Christiana to ask you a few questions, only because I'm sharing my screen, so I don't have the document in front of me to reflect on, so that we can consider that going into the group work and the dialogue. Christiana, over to you.
Yeah, sorry, I don't have the questions in front of me at the moment. But Jai, why don't you start off with just your general reflections, and while I find my questions.
Thank you, Frank and Christiana. I think one of the things that we find is, of course, certainly the governance. For example, like today we are in a boot camp here with participants from 20 countries, and one of the discussions that came up repeatedly is like interoperability, for example, itself is a governance issue. Similarly, when we take the legislation or regulatory frameworks, like there is always this pacing issue, which is very well probably understood by everyone. Technological innovations are, the space in which the digital technology is evolving is always going to outpace the regulations and legislations that have been actually there for quite a while. So there are ways and means that are being currently deployed, and also in a democracy, to change the laws and regulations, it's a lengthy process, often taking several years. And then, like especially like in a process like this, it also involves a lot of public consultation, which takes time, especially again in a multi-party democracy. These are the considerations that I think we need to be patient. But nevertheless, like political will is the most important thing to get started with. And then like regional networks like us also play an important role when it comes to building consensus, getting the right stakeholders on board, and then actually supporting the countries. So that is something that is on the top of my mind currently. Like, for example, like we have been actually working on the convergence approach in terms of supporting countries, be it like development of a national digital health strategy with a costed blueprint for its implementation, or like we already have a strategy, but that is not yet operational due to certain issues, like how do we actually get people on board, uh, not only those from the government, but also national professional societies, the civil society, the other ministries, not only the Ministry of Health, but then there are other ministries which are relevant and key for digital in health. And then also external agencies or development partners and donors as well. So, it is a multi-stakeholder, approach. That is something that we have been actually working with countries. So that is something that comes to my mind. Also, with respect to legislation, currently, like actually, we had an open call in our region, and then this is a project that is being collaboratively done together with Transform Health, and we had an open call, and then like some of my colleagues, and then some of the participating countries are very much also I think are in this call, maybe they will be able to elaborate later or share how they are approaching. But we made sure that whoever is going to participate, because the topic is on legislation, not everybody is able to actually have that kind of a convening power on this. So we made sure that it is the expression of interest actually comes from the government, and then also like so they should be on the lead. So that is the starting point. And then of course like getting all the relevant stakeholders to be on board, because some that's also again a challenge, like how much is sufficient is also a big question, especially in a country that is quite diverse and large, and then also especially with a larger federal setup with multiple provincial governments or states. Often some of them could be actually not from the same party. These are the challenges that are there in terms of course, the political will and the commitment. But I think having the government actually taking the lead is very important, especially when it comes to legislation and regulatory frameworks. Otherwise, like we can probably wish for the best, like unless otherwise they are on board, and then it is our duty actually also to support, work together with the government, because there are multiple priorities and issues. So if we can work together as a community, and then again, I think in the initial part of Frank's introduction, like he mentioned about technology is not an issue. Again, during the boot camp today, like earlier today, like we had a similar discussion, because uh, it is the community that can actually make a difference. So technology is evolving fast. It is solving problem, but more than the technology, the focus is on the community. If we want a change, and if you want it in a particular way, then I think that it is the onus is on the community to work together to resolve issues. So this is something that comes on the top of my mind. But please let me know if there are any specific questions that you would like to have ask me. Thank you.
That's fantastic, Jai. There's some great insights there. Thank you so much, and especially from your position of expertise working with governments on some of these issues and strategies and blueprints. Let me pivot to Martha now and get a take from maybe a less technical but a more legalistic and perspective. Martha, please share some of your thoughts on the importance of legislation and regulation, and maybe share some of your experiences with the Digital Health Act in Kenya and the difference you've seen.
Thank you very much, Frank. Kindly confirm if I can be heard clearly.
Loud and clear.
Thank you. Thank you very much. First of all, thank you for this opportunity. Kellen has been very keen on advancing digital health and digital health rights, and I'm happy to be part of this discussion, and also as the coordinator of the Transform Health Kenya Coalition. So I think when we approach digital health for us in Kenya, or for us as Kellen, we approach it from human rights and governance lens. So for us, from a legal perspective, we had to ensure that we have the right laws and policies that support successful digital health transformation in Kenya. We are heavily guided by Article 43 of our Constitution, which advocates for the highest standard of health. And we are also advocating for the same when it comes to digital health services, as well as digital health transformation in Kenya. So what we are keen on especially is accountability, and the law has helped us to provide accountability. We have a very young Digital Health Act that was just passed around 2 years ago. So the development process of the act meant that Kellen and through the Transform Health Kenya Coalition had to be part, or to take part in the development and be at the table when the law was being discussed. And thanks to Transform Health, we were able to have several discussions and also borrow best practice from different regions. And I believe that that's what helped us to get to the point whereby we had an act. And we have a devolved system of government. So we have our national government and we also have county governments because health is a devolved service. So not only can we pursue digital health transformation to the national sphere, but we are also expected to do the same at the county government because they're the main implementers of digital health. And that's where we need to ensure digital health transformation is spearheaded from. That is the point of implementation. And through the counties, we have the different groups that we advocate for in terms of digital health. So that is why accountability is very important for us. So having the right laws and policies, having the right personnel and having the right resources was also important for us. And those are some of the key things that are important and paramount when we want to achieve digital health transformation. So having the right policies, the right resources, whether it's financial resources, human resources, the right type of technology and infrastructure to ensure that digital health can be experienced with rights-based approach is something that we were keenly aiming for. So Kellen actively participated in the development of the Digital Health Act, and we had our coalition members, Transform Health Kenya coalition members participate in this as well. So we had representation from different groups because representation matters. Communities were represented, marginalized communities were represented, key and affected populations, women, youth who are very key in terms of leading digital health transformation in Kenya. And we were also, I can say, a bit lucky to be in or to be experiencing a government that was very key on digitization. So I think that was a low-hanging fruit for us in terms of having the Digital Health Act. But we have the laws now. We are now keen on implementation. We also have the Data Protection Act, noting that data protection and health being considered important data to we are keen on privacy, ensuring that there's privacy as we seek digital health services, implementation of the Data Protection Act, which came in 2019, just before the Digital Health Act. So just forming a nexus between the two laws and ensuring that we have policies and regulations that support the same are very important for us. And our role as civil society is to provide, not only to give technical assistance, but also to provide oversight on the government. Yes, we have the laws, we participated in the process, but it is our duty to see the process through, to see implementation of some of the interventions that are being suggested within the Act. So we have supported the same and we continue supporting the same as the Transform Health Kenya Coalition with our different partners. We have around 33 members and all have different expertise from health informatics associations, for community-based organizations, civil society organizations, academia, researchers, and so on and so forth. So we believe that it is our collective ambition and as well as our collective challenge to ensure that there's digital health transformation in Kenya. And in order to achieve that, we must ensure that real accountability frameworks are made a reality, and they're not just statements that we are putting in the laws and policies. So the road ahead seems quite long. However, I think we are putting the right pieces together to ensure that we get to the promised land. Thank you.
Fantastic. Thank you so much, Martha. Jai, I see you have your hand up. Is this related to the comments that the intervention Martha made?
Thanks, Frank. I can wait. No worries.
I just wanted to hand over to take the opportunity that laws and legislation, regulation depend on effective legislators. And I wanted to invite Guilherme to share a few thoughts from the AHIN perspective on what you're seeing in relation to this and how we can work more effectively with legislators to drive forward an effective and stronger legislative set of body able to manage it.
Thank you so much, Frank, and thank you so much for having us here, collaborating with you on this very nice event. It has been very enlightening to hear everyone speaking about the current state. Let me briefly introduce Unite as well, also as a quick introduction. We are a global network of current and former parliamentarians dedicated to advancing global health. We are currently have 518 members across 119 countries. And we do work closely with Transform Health, which we're always very glad to collaborate. And these events are always very interactive. Through our digital health policy desk. And we try to position parliamentarians as the key drivers of governance, accountability, and legislative reform in these areas. And what we've been hearing today, especially with the Mentimeter, was very enlightening to understand that people actually identify as the big flaws in terms of existing national policies and legislation, the gaps, inadequate or fragmented legislation, and Marta just mentioned as well the need for accountability in terms of following legislation that was already in place. In fact, one of our members, Honorable Amida Kibwama, was very active in the discussion of the law in Kenya, which we're very also proud of it. And so our mission is really to translate how these global frameworks can become actionable laws, and they can become actionable in terms of parliamentarian oversight. We believe that digital health is not just a technical transformation, but is a political one, which I've also heard a lot today, in which legislators can play indeed a decisive role in shaping systems that are inclusive, ethical, and rights-based. For us, we see digital health as well as a lever in terms of promoting universal health coverage and basic justice and resilient health systems. But our experience shows that our countries still they don't spend enough on the health budgets, and parliamentarians can have a role on that. Can also have a role on deciding internal budgets. So why parliamentarians? Let me also quickly read, because we believe that parliamentarians, they do a nice, not going to say counterweight, but they can put governments in check, because they're actually the discussions in the parliaments. They also complement the government's action. And we, being a partisan network, we try to promote that health is seen as a consensus, and so digital health can be a matter that is agreed as a public common good. So parliamentarians can have the legislative capacity. They can also pass laws, so they can make it more coherent, more focused, more efficient. They can use their oversight tools to bring governments into their accountability through hearings, resolutions, budget audits, and indeed effectively holding governments accountable. And of course, bringing political coherence by connecting all the ministries, all society, finance, and so they can indeed ensure that digital health policies are aligned and avoid these fragmentations. And so parliamentarians can also be leaders on their own, and they can push these agendas. And so we tried that with our network to promote it on that way. So the Transform Health Roadmap to 2030, we believe that offers a compelling blueprint, builds on the pillars that are indeed the most important in this matter, namely equity, national leadership, financing, governance, and participation. For us, of course, what stands out most, it's the recognition that political leadership and governance are the missing links between innovation and equitable impact. And from Unite's perspective, this roadmap can become really actionable if parliaments are empowered, and we're working on that way also to promote in our parliamentarians. We believe that governance, financing, and representation are deeply interlinked. And the effective digital transformation begins with strong governance. I think we've heard it a lot today. I think the true impact is how actually to make it work. So I would suggest also you can refer your parliamentarian to us. We specialize in promoting these tools for parliamentarians to be briefed upon, and also to become champions if they're not already. If they are, then we promote their voices in global health forums so that they go back to their national parliaments further empowered. Lastly, I think that the question is really who will make it happen, and we believe that parliamentarians can. We'll work with Transform Health and all the partners present here today to bring this call of action into virtuous action.
Fantastic. Thanks so much, Gideon. Well, all of you have mentioned the critical role of civil society in driving this forward and ensuring that everybody is aligned and accountable. I'd like to invite Patrida Paul to talk to us a little bit about the experiences of civil society engaging on legislation and regulation in Tanzania, a country that has just undergone an election, and how the role of civil society becomes critical in driving forward a policy and regulatory agenda that is rights-based and equitable. Over to you, Patrida Paul.
Thank you so much, Dr. Frank. And greetings, colleagues, once again. I'm happy to join this session, which is a very important session, and it comes at a great timing, especially when we just came off elections and we realized also the digital space was restricted, which impacted majority of our lives for the past 5 days. So I'm going to be sharing some brief insights on how CSOs can actually come on board and bridge in the gap to impact. So first of all, I think we need to understand that civil society organizations are instrumental towards promoting the digital health scope. As ourselves, as ILI, working at the digital health empowerment framework within the country, have showcased this through the fact that we actually work directly with communities. And I think majority of CSOs throughout the world, not only in Tanzania or in Africa, are actually working directly at community. And this actually creates that bridge whereby we bring the stories of data at community level to help legislators. I think my colleague Martha did mention about the policies in place and how best they are working to transform different health related data governance policies. But in order for this to be actually transformed, you need the data, which comes from civil society organizations working with community in the ground. And we've actually amplified this through different interventions, looking at how best we can actually have discussions, not only with fellow CSOs that are working on the health data governance scope, but the general public. So we actually led different outreach intervention activities through surveys, public consultations. We actually even went to hospitals ourselves to counter check how best is data managed and what are the loopholes. And one of the interesting facts that we noticed within the loopholes itself was looking at the fact that in our country, and it could happen in most African countries, we don't have an actual valid digital health strategy document in country, or a digital strategy document in country. The current one that we had in Tanzania already expired, so we actually don't have proper information that is accurately documented with evidence. And without that legal backing framework for health data governance promotion or digital health data governance promotion in country, we are working, how can I put it? We are actually working without justification and that back support system. So actually our role was to ensure that we develop a e-health data governance manifesto because we are talking about health data governance. We had to make sure that it's accessible online, and the fact that parliamentarians were involved, and together we actually engage different parliamentarians themselves, because they are a bridge to actually table changes in parliaments, but also they actually co-monitor the implementation of digital policies together with CSOs, because in most countries we understand that most policies and most laws to take effect, it's the parliamentarians that actually drive the process forward. And I think with this roadmap that we are working on to ensure that different national policies and legislators are actually walking the talk and still mobilizing the baton towards digital health governance, we are actually ensuring the fact that not only our rights as citizens, as people in the communities, because CSOs are generally working for citizens and people in the communities to bridge that channel to different key decision makers. Their rights and access to digital information is shared. But I think one of another aspect that I wanted to share more on is how best as CSOs we use storytelling through different platforms such as the radios, the local forums, to raise awareness on digital health data rights that actually matter. And I think, Dr. Frank, you remember we actually, through the coalition network in East Africa, we actually led the My Data, Our Health campaign, which had a lot of impact. Up to today, we still have some of the young people that we engage and some of the different community leaders that we engage that are actually still spearheading it at their community levels. So I'm going to stop it there and welcome any discussion points that we are going to have at some point, and then I'll come back where needed. Thank you, and back to you.
Thank you so much, Paul, for those great reflections. Jai, I want to take I saw your hand just went down after being up for so long. Let me invite you to chime in, and then we'll have to quickly move on to the next.
Thanks, Frank. I just wanted to add, I think a lot has been already said of some of the things involving what I wanted to say. But just wanted to quickly add, I think UHC as having an overarching theme actually gets a lot of people in the country, including legislators around. That is something that we have seen from EHIN. Like we have been actually having many of the annual conferences that we do. The theme was actually related to UHC, and this has also come up in multiple other discussions. Because why digital health? Why at all? Is it for the sake of digital health? No, this is for the purpose of health. And then UHC actually is a theme that actually gels well or echoes very well with a lot of stakeholders. So I think having that as a goal, I would say that as a theme, actually brings around a variety of stakeholders to work together, coordinate, collaborate, and then to have and converge. Their probably also iron out the differences to work together. I think that's something that I also wanted to bring. Means if we can have some overarching theme that actually can bring together people, I think that's one way of actually getting around this issue of having these policies and legislations that are probably not in the current era to kind of get to support the evolving developments in the digital space. That's something that I wanted to highlight. Of course, many of the other things have been already said by other speakers. Thank you.
Fantastic. Thank you so much, Jay. Yes, I've taken note of that. I'm now going to hand over to Christiana to take us through the Miro board and to really engage the participants on this call and in the co-creation of this particular thematic focus. Christiana, over to you.
Yeah, I wanted to do that. I will do that. I just saw someone's hand up from the participants list. Was there something that was really a burning comment that individual had that just wanted to add their perspectives? I don't want to. Okay, no, it's okay. All right, everyone. So we're going over to the next session. Yes, Jacob, you have your hand up. Nope. Okay. Okay, everyone, please just withhold your hands for a second. I'm going to start the session, and we love to hear your thoughts on what our co-hosts had reflected on, anything that's particularly that resonate with you. We'd love to hear it. Even questions for them, if they have time for it, we'd love to have it. Please write it in the chat box. We'll go to our next activity, and there will be lots and plenty of time for everyone to reflect. So 1 second, let me share the Miro board. I will also share the link in the chat box for everyone to join. So the point of this next session is to really unpack the kind of core ambitions that we've proposed or we've come to have kind of emerged, come to the fore in our analysis, and to like unpack that further and have the kind of co-hosts sort of lead unpacking that. I'm going to share the link. Sorry, I got excited about my data or health. It was mentioned in a previous conversation. There's the link to the Miro board. I'll go over there. I'll share my screen. So essentially, we welcome our first co-host, Guilherme, to sort of lead the unpacking of this. There are some guiding questions in which we've had that we really want you to kind of think through. And am I sharing my screen actually? No, not yet. Sorry. Now I am. So here you'll see the first board on the left, and that's the first ambition. And then as we go through the conversation, there are more ambitions here, but we'll start off with the first board on the left. And I've already put some Post-it notes in for comments and reflections, but also we really encourage folks to put up their hands or write in the comment box. We'll be monitoring it to make sure that people feel that they can engage the way that they'd like. And also, if you want to get more, an additional Post-it note on the left here, the kind of third one down, here you see sticky note. You press on it, you pick the color of your choice, and you bring it over to the page, and you can add another sticky, but there's some there already for you to use. So Guilherme, as you know, we are doing the dialogue now in plenary. So over to you to engage our participants on this discussion, and we'll monitor the Miro board to kind of take out any highlights or kind of key points that have emerged. Over to you.
Absolutely. Thank you so much, Christiana. So Ambition 1 tells us that every country has a rights-based framework for digital health governance. Laws, policies, and institutions, they protect privacy, security, and ethical data use by default. So does the audience think that these are well aligned? Are these the right sets of ambition?
Okay, let's see. Has everyone in the participant list seen the link to the Miro board? Shall I reshare again? Or can someone else reshare it, please? So to reiterate the question, sorry, I'm trying to get this thing out of the way. To reiterate the question, so the ambition
Yes.
that proposed is that every country has a right-based framework for digital health governance, that laws, policies, and institutions are protecting privacy, security, and ethical data use. Does this feel like the right ambition to the participants? Yes, no, maybe?
Anything missing from this?
Yes.
I guess people are getting still used to the Miro boards. Is that it? So, okay, I see someone writing it is. It would
It
be
would be
good if
ideal.
national laws were compatible with each other, so based on regional and global frameworks underpinned by human rights. Okay, yes, it is. That would be ideal. These laws need implementation and oversight mechanism. Okay, hovering through this idea that national laws could be compatible, we believe that it's probably it's a good idea if they have a concrete set of common evidence and common goals. But perhaps a model law would not exist country by country because each country has also its cultural specificities, I would say. But overall, do you share these ambitions, and would you be willing or working towards them? Do you feel that your organizations where you're based, would you be willing to work towards these ambitions? Do you feel there's the space to contribute to them?
If you want to speak, I mean, you can put your ideas in post-it note, but if you want to speak out, just put up your hand and we'll open the floor for you. Oopsies, sorry.
Any volunteer?
Yes,
So
Francis. Sorry, Francis has her hand up. Sorry, Garam.
No, go for it.
Francis, go ahead.
Okay. Yeah. Good afternoon, everyone. I'm a member of parliament from the Republic of Malawi, and looking at the ambitions, the ambition listed that every country has the right best framework for digital governance. Taking you back to the Republic from 2025 to 2030, where we had the digital health strategy. As the National Dialogue Table, as a member of parliament, we have what increased budgetary allocation to the ministry, around 2019, 2020, we were given 40 billion kwacha budget, that is $55,000, just to manage the digital health strategy. So if you ask my role as a member of parliament in the National Dialogue Table, one is to ensure that the budgetary allocation to the Ministry of Health is enough. And number two is where we need to track as National Dialogue Table representative and fellow members of parliament to ensure that it's not only the figure that we put in the budgets, but we need to make sure that the ministry is funded. So as we speak as at now, I think the political will from the constituents up to the national level is high now, such that with the information bill that was presented through some government institutions like MACLA, I think issues of digital health is gaining momentum. So I think we have a bigger role at a national dialogue table where the Health Committee has people that have passion towards ensuring that digital health is promoted. So I think we have a bigger role. We have a bigger role. Thank you very much.
That is great news. Thank you so much, Honorable Francis. And I believe you just joined Unite recently, so congratulations. We haven't had the chance to meet, but we will soon. So let me pose you a follow-up question. Like you just mentioned that the will and the momentum now is great. Would you feel that this ambition could be something that the constituency or the Parliament of Malawi could be driven by? Or do you think that we're missing anything in the sets of ambition?
No. As of now, I'll take you to the national dialogue table. When we have 21 members in the FA committee, these are the people that are put in the committee from the point of knowledge, people that understand the health issues. That's number one. Number two, when we go to the political structure, the minister of health is a person that from the professional and the health background understands what it means to talk about digital health. That's number one. Number two, so we're talking about recruiting or appointing people that understand the health issues. That's number one. Number two, when we talk about since joining national dialogue table in 2019 up to now, I've seen each passing financial year when we go for budget sitting, the budget allocation for the Minister of Health is second from the Minister of Agriculture, and this time around we are sitting this mid-year, and we have seen a lot of civil societies, a lot of members of parliament from other committees advancing that we need to increase allocation to the Minister of Health. And as at now, I can tell you, we have been told by the President himself that he will increase a lot of funds at the constituency level, and he has indicated that we need to make sure that health issues are a priority, and in fact a priority where I want digital health to go to the communities and to the constituencies where somebody from a constituency need to understand what it means by saying digital health. So I would say I think we are having the passion, and I think the political way is starting from communities going upwards. I think it's now a role. You need to make sure that the funds that you are given at the constituency level, you need to allocate around 35% to the health sector. So I think we have.
Okay.
Yeah, sure.
Sounds. Thank you so much. So sounds like you can collect or you are collecting the passion, the political passion, the will, and also the funding, which we feel that it's a great mix to advance things. So I would like if anyone else wants to jump in and reflect if in your realities in your countries, would this ambition one, would it be achievable within the 5 years frame? Or do you feel it's still long to go, even with a mix of political will, increased funding, and passion? Does anyone want to reflect on the feasibility?
I'll reflect. And it's funny because I'm from Canada, and obviously not obviously, but the Canadian government is working on the integration of or the centralization, I should say, of patient rights and the right to health as being kind of integral to its sort of policies and institution security. But I think that there's still a lot missing from the conversation, because fundamentally there's still kind of lagging conversations on the integration or centralization of rights across all systems, across all frameworks in the Canadian state. And so in some ways, even though some areas are improving, ensuring that privacy, security, and ethics are central. There's also kind of overarching kind of meta challenges that are in kind of intrinsic to the systems that make the nation state. For instance, like the fact that Canada is based on, colonialism, and it comes from that background of kind of challenges around Indigenous rights. There are still fundamental kind of rights issues that underscore a lot of things, that those elements have to be addressed first before digital health governance can really, and policies can really address or tackle inequity, because inequity is sort of the overarching issue. And so for me as a Canadian, I feel that I don't know if we'll get there by 2030, because those fundamental challenges, those inequities are still there. And those have to be addressed first. So that's my perspective.
Thank you so much. And I see how that can actually undermine the trust in the old
Yes.
system, and that it could further compromise the adoption. Anyone else want to jump in and perhaps tell us a little bit about your reading of your own reality, your own country? So I can share a little bit also, maybe from Portugal. I believe that we have advanced a lot in terms of sharing. I think that interoperability probably it's still something that it's an issue, and I would say that all these ambitions could still be improved, especially when discussing private and public ownership of data. But so probably we need to move to the next ambition as we've been here. So I believe that I will pass the baton to a new moderator, and it was a pleasure for me to.
Thank you, Guilherme. I just see Paul's hand up very quickly. Paul, do you have one quick thing to add to that before we move on to the next ambition? Nope. Cold feet? All right. All right. Thank you. Thank you so much, everyone, for that. If you scroll right in the Miro board, you'll go to the next ambition. And this is being hosted and moderated by Martha. So Martha, over to you.
Thank you. Thank you very much. So the next ambition is that accountability and oversight mechanisms are independent and effective. Public trust is strengthened through transparency and regular view. So in the same way, are there any comments that anyone would like to make on this specifically? So maybe we can start thinking about that. And maybe I could also just start by probably giving a general perspective on this. Oversight is important, accountability is important, and there are different ways of seeking accountability. So we can have independent and effective oversight mechanisms. Oversight mechanisms are considered, at least I can speak from a Kenyan perspective, to be spearheaded by civil society. However, it's also a role of the government to provide its own oversight when it comes to implementation, for example, ensuring that whatever laws and policies that they have put forth are being governed by independent bodies, or oversight is provided by independent bodies which are free from political and commercial influence. We have, for example, in Kenya, the Office of the Data Protection Commissioner that should be empowered, or is expected to be empowered, to audit and enforce compliance of health data systems. So is this something that is possible in the different countries represented here, or in the different regions represented here? And also when we talk about accountability and oversight mechanisms, looking from a public perspective or a community perspective? Should we be advocating for community-led monitoring and oversight? Because I think this is essential as civil society, as community health advocates, as people who are can be considered opinion shapers within the community. Should we look up to such people? What are the best methods of monitoring when it comes to the digital health projects that are being rolled out within our communities? We all know that also transparency is a key pillar of public trust. Can we say that our governments are transparent in terms of rolling out digital health interventions, digital health transformation, innovations, and so on and so forth? I will move over to the Miro board. Feel free to continue adding to the same. Yes, I can see we have several comments. There's one saying that under freedom of information, access to personal health data should be in the hands of the patients and to their guardians. I believe that is actually very important. For example, in Kenya, we consider data to be owned by the patients, guardians in cases whereby the patient is unable to represent himself. I can see a comment that there must be public trust and transparency. This is not always the case, but this is what is some of the things that are key in terms of ensuring that accountability and oversight mechanisms are implemented. I will request for help in case there are any hands that are up. If anyone would like to speak up and comment on anything. Can see another comment that transparency is vital but hard to achieve in some institutions. That is very true, because it's hard for institutions to look inwardly and identify the wrongs that they're doing or the areas where they may need help, and they usually need a little push. And I believe that is part of our role as civil society. There's another comment that data should only be shared, not sold. Data should only be shared and not sold, so that the mining of data is not possible, as the commercial aspect leads to all sorts of questionable activities. Yes, I think as countries, we should ensure that we have the right safeguards to protect data, and specifically health data. And digital health platforms are avenues whereby we share a lot of data, and we have cases whereby this health data is not even stored within the country. I remember at some point in Kenya, we are hearing about clouds and data centers which are not even within our access. And there was a lot of data mining, even when it comes to health data. So those are some of the things that or rather some of the comments that I can see in this. Another comment is that MPs, CSOs, and people together should have the right laws to hold institutions accountable, especially on their personal health data, especially when big tech firms are also involved. Yes, and I believe MPs are the legislature, so they're the ones who are capable of passing laws and amending laws, and also CSO, as usual, will play a big role of oversight and ensuring that there's accountability, but also the community is meant to spearhead oversight as citizen. Community-led monitoring is a very powerful tool, and I believe that if we use that, we're able to ensure that our data is safe. However, in order to achieve that, we need to ensure that the community is informed in a language that they understand, in ways that they understand, on how to interpret these laws and apply these laws, even when they're speaking to the leadership, the MPs, the government itself. So I will take a break there and see in case there's anyone who has a comment, anyone who'd like to speak up.
Do partners on the call, I mean, our participants feel that within the trajectory of 2025 to 2030, or perhaps 2026 to 2030, do we see this ambition as being achievable? Is this something that could be achieved by 2030? And if so, how? How would we get there? What would an independent and effective, oversight or accountability mechanism look like? Please, Solomon, I see your hand. Go ahead. Solomon first, please. One second. I see your hand, Solomon. I'm trying to allow you to talk. Where are you? Solomon.
Okay,
Voila.
am I audible now?
Okay, great. Oh, sorry?
Yes, can you hear me?
Yeah, please go ahead.
Okay, Solomon is my team member. My name is Maureen.
Okay,
And
hi.
I work with the Uganda National Medical Alliance for Prisoners Support. It is based in Uganda. When we talk about achieving this ambition by 2030, if I'm to say that out of 100, according to the area I'm working in, achieving it will be at 30 or 20%. Because when we talk about digital health, when it comes to prisoners, as an organization, we work so hard so that we link these people from prison to health facilities. But linking them to healthy care is kind of hard because we need data from the prison system to get the information about those who have medical issues so that they are linked to the nearest health facilities. But this is hard because the prison system itself, there is no trust between the prison system and the CSOs because they are not sure how transparent we are going to be. They are not sure how we are going to use this information because it is so sensitive. Sharing information about prisoners is really sensitive here in Uganda. So achieving transparency and is kind of hard when I look at it here in Uganda when it comes to the closed settings, especially for the prisons. That is what I wanted to comment about. Or else, if there is something we can do about it to increase the trust between the prison system and the community and the CSOs, that would be great. Because even recently we faced someone tried to hack our data systems. So that is our biggest challenge. Over to you.
Thank you. And what an interesting perspective about the prison system as another layer of inequity and inaccess. We don't often think about prisoners' health or rights as being part and parcel of a conversation. So thank you for bringing that aspect in. There was someone else that had their hand up after Solomon. Anyway, the board is now, sorry, I didn't mean to take over, Martha. Please go ahead and continuing. I just felt we could ask that next question. Yes, please go ahead, Tuan. Tuan?
Can you hear me now? Hi.
Hi, yeah, hi. Hi.
And thank you very much for the sharing. Very good. The idea about the ambition. Ambition. So, but back to the first ambition about the law and regulation. Right now in Vietnam, I just want to mention about I'm Tuan from the National Health Commission of Vietnam. So So we are really care about the law regulation for all. So we recently, thanks to the commitment from the top level of the government, so we have a lot of the the law regulation have been issued and applying for recent year. So we also care about the most important thing right now. We are lacking either like the infrastructure and the device for the digital health. So especially for the grassroots level, at the lower level. So we also are doing the centralized data at national level. So for healthcare, we also doing like the health data transfer. Yeah, we have like the also doing the EMR, ESR right now. So actually the system and the data still like fragmented. So we still are like pooling data right now. So also lacking of like some standards that could be like interchange with the international standard and other countries, such as the SL7 file, and so especially the quality of the data is not really good, and so we are hardly to applying the at the big data or AI in healthcare. So we especially like the quality in the image, MRI, CD, or X-ray, DICOM, etc. So we have faced with a lot of problems like this. We really want to like learn and from the other country, and thanks to the sharing, we can learn a lot from the other country and how to do with the law and regulation. Yeah, thank you.
Great. Frank, over to you.
Yeah, I just wanted to reflect a little bit on that last comment by Tom. I thought it was very interesting. This issue of data quality is very important, and a lot of interventions have gone into the system to try and improve quality of data. But I think the incentive structure or the targeting of those interventions make a whole set of assumptions that that there is a shared if you like, desire and buy-in from frontline healthcare staff to generate good data. Many, in fact, do see it as a burden, an additional bureaucratic burden that takes them away from frontline care work. And nobody is really looking at the role of the patient as a data owner. I think that the only parties or the only party that's really interested, or the two only parties that are really interested in the quality of health data, is the patient themselves and the health planners that are using that data and rely on its accuracy to improve standards across the system. Obviously, the practitioner and the frontline practitioner will do that, but the medical examination will come first in many ways. So I think that looking at repositioning data as a valuable personal asset that's critical to healthcare, as well as individual rights, and trying to bring in the patient's responsibility to ensure that that data is accurate is a little bit of a grey area that hasn't really been addressed to date, and it might be important for governments to look at how they can encourage citizens to become data subjects and fulfill that data subjectivity in a much more responsible manner.
Great. Thanks for that addition, Frank. Peter, over to you, and then we'll go to the third ambition. Thank you, everyone, for your great comments. Peter, over to you.
Yeah, I just want to retaliate on what Frank has just said, because we got a big problem in that area. where the data that is captured in the health system doesn't belong to the patients. And I have a practical experience that when I wanted to get a different opinion from the doctor that had diagnosed me, they refused with the data because they had already made prescriptions. So in spite of the fact that we had paid consultation fee, I wasn't able to get my own data to get another opinion or to procure the drug from a different pharmacy. And I don't know how we are able to do that by 2030 to make the data, as Frank has said, belongs to the citizen or the person who is in need of treatments. Thank you.
Thank you, Peter. That's great. All right. So over to the third ambition. Frank is taking Frank is taking on this one to lead. Over to you, Frank.
Yeah, thank you so much. And Peter, we will be coming back to some of these questions. So thank you. That thought has been recorded, and we may reach out to you for more information. So the third ambition, cross-border policy coherence is achieved. Countries and regions collaborate and share governance principles. Oh, that's better, thank you. Harmonized standards and mutual accountability. Does this look like an ambition that is worth pursuing in this roadmap? Do we think it would respond to a need that's currently lacking? And how can we work on it together? Now, I'm going to be like a commentator at the horse races. I'm going to try and reflect on your comments, and my commentary is going to be as exciting as the race itself. And the race is going to be the comments you paste up on this board. So please go ahead and give me something to comment on. Your thoughts and reflections, please. Currently, just to position this a little bit, and Kirsten, if you want to come in at any moment, please be my guest. There isn't any cross-border frameworks that establish clear protocols between different countries in relation to the sharing of in relation to coherence in relation in terms of governance and accountability as it relates to digital health or health data. There are standards, these are technical standards, but there aren't any legislative and regulatory standards. Kirsten, over to you.
Yeah, I think here just an important point to reflect on. It'd be great to hear others' thoughts and not undermining, because as we saw, an earlier ambition is very much around countries having those strong national legislative frameworks, but realizing that, you know, people, diseases, data, those cross borders, and how can countries work together to ensure a certain level of legislative standards to facilitate and to have that kind of compatibility to facilitate more secure data sharing across borders. But then also recognizing that, you know, different countries are at different stages in digital maturity, including around their legislative framework. So just recognizing that a lot can be learned from that cross-border data sharing of how countries are approaching this, where there are challenges, there are gaps, to kind of bring the best pieces together to establish a global standard for what good legislation looks like. So promotes that harmonization, cross-country sharing, but then also to through a framework establishing those cross-border data sharing protocols as well. I think really important that while kind of seeing the regional and global collaboration is important to kind of further more robust health data governance, that this, of course, does not undermine national data sovereignty, which is essential as well, but more of how it can kind of help countries move forward together.
Brilliant. Thanks, Kirsten. Martha.
Thank you, Frank. Yes, I think cross-border exchange and cross-border learnings are very important. I can give an example of the East African regional bloc, whereby a lot of policies around health on different aspects, not only digital health, are being shared and deliberated upon, and there's a lot of CSO engagement in terms of passing regional laws that can be localized and adopted. So best practice in terms of digital health can also be borrowed. For example, I think in the East African community, Kenya is the first country that has a Digital Health Act and is actively spearheading digital health from a legislative perspective. So this can help pull up the other countries or necessarily borrow best practice in terms of even contents of the law and be shared across the different countries. It helps the other countries pull each other up and ensure, in case we are in the era of cross-regional and cross-country trade, as well as cross-country access to healthcare services. We have a lot of countries or citizens from different countries seeking healthcare services from Kenya, and we have Kenyans seeking from other countries. So I believe that cross-border collaboration and shared principles in terms of governance and also harmonized standards can play a very huge role when it comes to ensuring that there's proper digital health transformation and exchange of best practice. And yes, of course, accountability, because if you have a regional law or a regional policy, it is up to the bloc or the governing institution to ensure that this is implemented across all the member states. So I think it's something that can be done. Whether it's achievable in the next 5 years, I think it's a conversation that is worth starting. And then we can talk about whether or not it's achievable once the conversation starts and we get to hear the views of the different countries. Thank you.
A cautious pragmatist there. Thank you, Martha. Caesar, let me open the floor to you.
Hoping that you can hear me because I see I've been unmuted. Yeah, just to also re-emphasize that point, I think the fact that in the digital ecosystem there's hardly borders is something we must be really cautious about. What it means is that beyond clinical access from one country to the other, where people cross physical borders to go access healthcare, there's also the tendency to use digital platforms, which themselves are hardly respecters of borders. So what it means is that a cross-border data sharing system is really effective, but it should only be the beginning, because we believe also that people do not just seek services from nearby countries, but also across regions, and from, for instance, Africa through to the United States, where some of our top citizens access healthcare. And so it means that we need to, as a beginning, get the cross-border border data sharing, but there's a real urgent need for regional and even global interoperability so that these systems can be connected, not just for the people themselves, but like we saw in COVID, countries may use data as a diplomatic, or if you like, political tools. And so sometimes the amount of data you see of COVID-19 cases, whether it is of quality or not, and what guidelines will be used to ensure quality, are all supposed to be ensured in this cross-border data sharing, which also calls for regional and global leadership, because countries may lack trust among each other in terms of the effectiveness of systems in the neighboring country. And so if there's a regional leader like we have for the Africa CDC in Africa, who tables some criteria, it ensures that everybody can be at ease, and there is somebody who will act as a referee if there is a conflict. Yeah. So, over.
Fantastic. Thank you so much, Caesar. I'm going to read a few of the comments in the chat, which are great. Politicians will only find activities that will benefit them. Unfortunately, that's true. But also, if they're voted out of power because they're not responding to popular demands, that doesn't benefit them. So there's a careful balance, but in general, I would agree. Ideally, governments, and from Lizzie, ideally, governments' priorities dictate what we will achieve by 2030. If government buy-in is around digital health and UHC and having the legal priorities in place, then by all means, 2030 is feasible. So countering some of that pragmatism there. Lizzie, thank you so much. Paul Kedjo. In Nigeria, while digital health systems are expanding, rural areas remain largely underserved due to limited electricity, internet connectivity, and mobile device access. Oversight frameworks and accountability mechanisms, no matter how well designed, will not be effective if large portions of the population cannot generate or access digital health data. Evidence shows that less than 50% of rural households have reliable internet, and many clinics still rely on paper records, which limits the usability of national digital health data. To make this ambition feasible in 5 years, we need strong partnerships between governments, private organizations, NGOs, and telecom providers to invest in infrastructure, digital literacy, and inclusive data collection. Paul, a very good comment there, and I would invite you to the dialogue we will be holding on Friday, which looks at exactly those questions. And we did say at the top of the hour, the top of this session, that these themes that we're unpacking here are interlinked, and we have one on resourcing and investment, which will be tomorrow. And then on Friday, we will have one on digital public infrastructure, where I think this comment is very well received and will be very, very important. Patrida Paul, I think that there also should be the need to establish a regional mutual mechanism for cross-border transfers of health sector actors, e.g. a mutual recognitions of a DPA decision, standards, contractual clauses for health data, as the current state of regional frameworks and national frameworks are mostly contradictory in SADC, YAC, and the AU. Absolutely. And I'd like to invite Kirsten back on to tell us a little bit about what we're doing in this space in terms of a regional framework in the Africa region that we would love to see replicated in others. Kirsten, would you like to share a couple of thoughts on that?
Yeah, absolutely. I think just to say as well, it's really showing the leadership within the region of recognizing how critical this issue is and really taking the lead and advancing that. So this is work being led by Africa CDC in drafting a continental health data governance framework. Transform Health, together with Helena and other partners, are supporting that through the Health Data Governance Flagship Initiative. And providing kind of support around convenings and consultations. But that process just kicked off earlier this year. There have been some initial member state consultations on the draft and kind of subsequent stages around member state and stakeholder consultation and validation is being mapped out now with the aim of that then coming to the AU summit for adoption by member states, by AU member states, to really kind of establish that continental kind of commitment and framework on health data governance, which would then also support both that regional collaboration, but then also support member states within the region in strengthening their own national frameworks as well. So yeah, really, really good example of that regional leadership. And great to see kind of how that can also be elevated as a good example at the global level as well, and global cooperation.
Fantastic. Thanks, Kirsten. And very good comment of a sober reminder by Francis here that we may have all the data protection frameworks in place, but weak data protection enforcement and skills in data literacy and fragmentation systems remains a challenge. And again, here is some of the conversation we had in the earlier session, very important for the role of civil society and others to keep pressing along that chain to ensure that legislation is developed and then implemented, and then the oversight is maintained. Rosemary tells us that different countries with different cultures need each other to combine ideas, so cross-border collaboration is the way to go. There is a SADC data protection agreement that member countries can adopt. It is not specific to health, but at least provides a start for sharing data across borders. Absolutely, we need to build on what's there, and I think Kirsten alluded to some of the moves that are happening at the AU level. Another comment that I want to sort of put back into play that Guilherme made, is that different countries have different legislative and regulatory frameworks and processes, so there won't be one size fits all, but there needs to be a common framework that establishes a certain set of standards that we can that will ensure mutual compatibility. And this is another thing that I've been reflecting on. It's we are the complexity of the issue. People's health data is also a national security issue. It's very important for countries and governments to know about this in order to, maintain the health of the population, but also control of population and control of potential threats to that population. But also data is a very global and fluid asset that is very difficult to say, okay, this stays here and you need a passport to get that data across borders. We saw what happened with PEPFAR in a number of countries when the plug was pulled by the US government. All the data disappeared and went back to the US, and there was no way of stopping it at a kind of border within a kind of digital space where borders are very fluid. How do we legislate using a notion of sovereignty that's based on 19th century principles, a context that's 21st century and much more fluid? I think that's a question that we need to ask ourselves in terms of not just the legislation, but upholding the legislation. And then what role does AI and technology play in that space and in helping sort of police that whole system? Those are some thoughts I wanted to just throw out to see if that generates any ideas in any of you. So Nina, thanks for participating. During the Africa Health Tech Summit 2 weeks ago, the Nigerian health minister said data is a sovereign asset. That's great, Nina. Would you like to elaborate a little bit on that? Would you like to tell us what your thoughts are on that based on the provocation I just threw out? I don't know if we can unmute you. I don't have... Nina, you're unmuted if you'd like to share some thoughts.
Check.
Yes, please go ahead.
Yeah, so hello everyone. I wasn't sure I could speak, so I was just in listening mode. Yeah, in valuing data, maybe from the last point about cross-border collaboration, it's important to notice that at least in Africa, there is the African Union, and then we have what we call the sub-regional economic commissions. They are not, it's not the same as the UN, but we have something like West Africa, it's an economic community. Eastern Africa is an economic community, SADC, and then we have the UMA, the Maghreb region, the North Africa, and the Central Africa, of course. So actually, Caesar and myself, I think Caesar is a Ghanaian national, I'm a Nigerian national. We actually have the same passport. like the EU passport, we have an ECOWAS passport. So I think that in that way, our data can flow. So we already have that free movement of people and goods as ECOWAS citizens. So there is that kind of movement already, which may be applied to data mobility, and in this case, the health data. But back to the Nigerian minister that chaired and a continental Africa health data governance high-level panel, by the way, which Transform Health was co-hosting. He made that comment about the importance of governance. And when I was briefing him, he was like, Nigeria as a country, which is the largest in population in Africa, holds their data as a sort of national, like you said, sovereign asset. It's the same as it's more than oil to Nigeria. And so governing data for Nigerians is not just, like you said, a matter of defense, but it is defense, it is security, it is economics, it is perspective. That is the way Nigeria is looking at monitoring their data, and that is why they have a data commission. So in many countries, they do not just have, they're not only just focusing on data governance, but they're actually data commissions. So a place like Kenya, for instance, Kenya has a data commission and a health, digital health agency. Nigeria has a data commission, and most African countries have data commissions. So when we are talking about governance and governing and legislation, these are the main players. So even if you're from health and you want to talk about health data, you are dealing with the tech people, and you're also dealing with the national data commissions, as the case may be. I'll stop so far.
Lovely. Thanks so much, Nina, for those reflections. I see a last reflection from Paul. I've captured it on the board. So I've cut and pasted it on the board, and we will get back to this. Unfortunately, we only have 3 minutes left for this discussion. And Francis, again, I will capture your thoughts and stick them on the board as well. And we're going to have to wrap up, I'm afraid. We won't have a chance to get to the last discussion, which talks about civil society engagement and the critical role civil society has to play. Not to worry, because we will open this up to further consultation. If any of you have any thoughts that you'd like to share on that, please let us know. But we will be sending this out again for broader consultation. So I want to just take this time to invite our panelists just to share a couple of closing thoughts on what you've heard. Let me start with, and if we could keep it brief so that we can keep this within 2 minutes. Patrina, Paul, over to you.
Thank you, Dr. Frank. I think this was a very proactive discussion. So ideally, my take will be, as we're still on to the discussion for CSOs, I think we would really love your inputs more once the Transform team does do a follow-up email or any input in particular, so as we can get the majority of inputs from everyone on the CSO's angle, but also in other angles that you didn't have any opportunity to add your inputs on. But I think our team, fellow co-hosts, we are here to continue this consultation and ensure that we drive this momentum forward and be able to be part of the transformative agenda. That's all from my side. Back to you, Dr. Frank.
Thank you so much, Patrina, Paul. Guilherme, can I invite you to share some final reflections?
Yes, absolutely. Thank you so much, and I also enjoyed very much this dialogue. I think it was wonderful. So, 2 quick reflections. The first one, how members of parliament can actually bridge the gap to build trust and policies and frameworks. We've heard a lot about this today, and especially considering they are the direct link with constituents. That's what we at Unite we try to do. The second quick thought is that in a very sometimes chaotic and very incoherent world. I think the work that you are doing, Transform Health, I mean, this roadmap, I think it sheds a lot of light into the path forwards, and thank you for that. And it's great that you carry along so many partnerships and so many partners along. So carry us with you. Thank you so much.
Thank you so much for those affirmative words, Guilherme. Martha?
Thank you. So a reflection from the discussion generally is that we all play a role when it comes to transparency, because transparency is a pillar of public trust. So the government has a role to play in terms of leadership, ensuring that we have the right mechanisms, the right laws and policies to ensure that accountability, trust, and transparency is definitely upheld. And we also have a role as civil society to ensure that the public and the communities remain informed in terms of their rights and in terms of all the digital health interventions that are there. So we must package information in such a way that they can understand it, for them to be able to implement or to also seek accountability from the leadership and from the government, and also comfortably access digital health in a safe, secure, and private manner. So that's my parting shot. Let's all work together, government, legislators, civil society, and communities, to ensure that digital health is implemented in the right way and using a human rights-based approach. Thank you.
Fantastic. Thank you so much, Martha. Well, let me just thank you all for taking time to participate in this dialogue. I will invite you to also sign up to the other dialogues that if you're interested in them. Some of the questions suggest that you are thinking along those lines. So we do hope to see you tomorrow and over the next, well, the same time for the coming week as we celebrate Digital Health Week. Christiana has put information on the dialogues in the chat if you'd like to sign up for them. And it's just left to me just to thank you all for a very rich and engaging discussion. We will use all this information, this rich information that's come up to build this roadmap even further and send it back to you all for further comments and engagement, so that we can have something that we're proud of and that we're happy to work together on over the coming years. So without further ado, I'd like to thank you again and wish you a very pleasant evening, night, or day, wherever you are. Thank you so much.
Thank you so much, everyone.
Thank you.